doctor and pregnant women and girls and moms to be. It's a nice platform actually, because sometimes when we are doctors in the clinic and we are not able to really devote so much time for so many issues that our women want to talk to us. So today here we are to talk about healthy diet and happy pregnancy. Now when we talk about pregnancy, it has to be healthy, it has to be happy, and we are trying to come and form a link between these two. Now when we're talking about healthy and happy pregnancy, we generally have this question, doctor, what should I eat, what should I not eat, and what is good for my baby? Will my baby become intelligent? क्या मेरा बच्चा गोरा हो जाएगा, बहुत intelligent होगा, class में first आएगा? All these qualities and everything. So finally it all comes down to what moms eat, not only when they are pregnant, of course, when they conceive, and from that time that health to it continues throughout the pregnancy. Now like we say ki har thali is not the same for everyone. Everybody is not going to have the same kind of diet or same kind of food in pregnancy. Now what is different? So let's go a little stepwise, that when we are talking about how much weight should I put on in pregnancy? That is my commonest question that girls are going to ask me. What is the optimum weight that I need to put on, and how should I plan my diet? So the first thing we must remember that when we are considering any weight gain in pregnancy, it is not a common a number for everyone. It depends upon your body mass index, and like we say, any girl who is, or any woman who's less than 50 kg weight at the time of conception, of course that depends on the body mass index. So if the body mass index is normal, then you should put on around 10 or 11 kgs throughout your pregnancy. If it's low, then it has to be a little on the higher sides, around 15 or 16 kilos in pregnancy. And in the end, if you see this on the higher side, you can all just have around 5 or 6 kg of weight gain throughout pregnancy. Now how are we going to go about this? Now this has to begin right from the first day of your conception. You have to start planning your diet. Of course, I very much understand that the first 3 months are not really easy. We are telling mother-in-laws and moms are telling them, please eat, now you're pregnant. But it is not easy, because the first 3 months are putting you down with morning sickness. But still, at the same time, you must try to see that your food items are full of fresh fruits and salads and juices, and a good amount of water intake, because that is the time when you're feeling pukey and you want to throw up. So at that point of time, the lesser cooked foods that you're going to have, the more happier you are going to be. Throughout pregnancy, when we are thinking about the diet platter that you are going to have on your plate every day, very important is see that you are planning your meals in such a way that you have at least 4 meals a day, so which are equally spaced out: a breakfast, a lunch, a snacks, and a dinner. Of course, each of them spaced out around four hours difference. And each of them, when you're actually planning your plate, you should see that you're having a good amount of proteins in your diet. Now when we know, like in school also, we have learned that proteins are building blocks of the growth. So when they are building blocks, so we must see that enough proteins are being consumed in the diet. Now the proteins can vary from whether you're on a vegetarian diet or a non-vegetarian diet, but it is important that you check your plate when you are having your breakfast, when you're having your lunch, when you're having your dinner, or snacks, that have I got some proteins with me, have I got some vitamins with me. And what is going to have proteins? It's, you can have milk, you can have eggs, you can have sprouts, a lot of options that are available for fulfilling your protein requirement. Second thing that what we are looking at is a good amount of iron, because your baby has to grow, and along with that your baby needs oxygen, and oxygen is going to come through hemoglobin, and hemoglobin is going to come through good amount of iron in your diet. Now when you have good amount of iron in your diet, it's obviously going to include all kinds of foods that are going to give you good amount of iron. Now that could be green leafy vegetables, it could be any kind of dates, and red looking fruits, to be very simple. So anything which is going to give you good amount of iron in your diet is going to be a part of your regular diet. Along with proteins, what we are looking at is calcium. And calcium, as you all know, that yes, calcium is needed for the growth of your baby, it is needed for the bones of your baby as well. So you need to have a blend of iron, calcium, proteins, and along with that, which most people tend to forget in, in this whole pregnancy diet, is that you need a good amount of fiber in your diet, because pregnancy is very prone to constipation, and also we are not really so comfortable, because you need to also regularize your bowel habits, because that is going to in turn decide how your food I mean your appetite is going to be. So that is very important, that you have good amount of fiber in your diet. Now along with fiber, something again we tend to forget is a water intake. Now water intake is equally important, because it's going to keep you healthy, it's going to keep your skin glowing, it's going to keep your urinary system in place, and also going to keep your baby growing well. So here we have something where we are going to balance the protein, we are going to balance the iron, the calcium. So now how am I going to plan all this? The question is that first 3 months I generally say plan what you like, because if you're going to eat a forced meal, it's going to be pukey. So whatever you like, but you see, when you have to be now you're in a different phase where you're going to decide the health of your baby, and your health of the baby is going to be decided by what the mother is going to eat. Now what the mother is going to eat, like we know, see, we put in a small little seed in the we plant a small seed, and then slowly it is going to grow into a mango tree. So what happens is, if you know okay, you want a good fruit, so you need to have a good seed. Now if you're going to nurture that seed well, then only you're going to get a good fruit. So it cannot be that automatically the baby is going to come out happy and healthy and everything is going to be rosy and fine. So this pregnancy is a little extra effort time. With the first 3 months with the pukey, it is difficult, but still that little extra effort is possible. And if you really think, moms are the best, because they can do anything for their babies. So that is why I always suggest that you should try to see that your diet is done well or planned well, especially in the first 3 months. Make your diet plan as to what items you are really able to enjoy. I have patients who will come and tell me that, ma'am, earlier I used to have a lot of milk, but today when I'm pregnant, and I just can't go with the milk and all that. So it's okay, whatever you like, but see that your diet is getting all the ingredients that are necessary for the baby to grow. So one thing is that you need to keep a check on your weight, that you're regularly putting on weight, because finally it is your total weight gain that is going to decide whether your baby is going to be healthy, whether it is going to be overweight, it is going to be underweight. That is going to decide how your delivery is going to be, whether it's going to be a normal delivery or cesarean. Your food is also going to decide whether you're going to have diabetes in pregnancy, whether you're likely to put on weight in pregnancy. And of course, I mean, most of the women would want to come back to their original fit figure after pregnancy, and your diet is going to really decide that. So we don't have to binge in pregnancy. It has to be a very planned kind of a thing. It's like a project that most of us in the offices also, we do have a project. Or when you have guests coming home, you're making a nice plan. This is going to be the starters, this is the full 7 course meals that homemakers make for the guests. So it's just exactly like that. We're having a guest who's coming home, and I think we need to plan the diet so well that our babies are going to come out healthy. So this is what I would want to start with, and we have a few questions which are coming in. So I have a question which says that, I have been suffering from diabetes for a long time. So what food should I avoid during pregnancy? Now, with as far as diabetes is concerned, it's important to remember that one thing is, in our country, the number of women who are suffering from diabetes in pregnancy is increasing. One thing is because of a little sedentary lifestyle, because of binge eating with junk foods. So we are getting many girls and women who are already diabetic before they are pregnant, or they get diabetic when they are pregnant. So what you need to avoid is anything which is extra sugar. So what one thing you have to do is, when you're any person, whether you're diabetic or non-diabetic, generally I would say that cut off your extra sugars. Extra sugars meaning your cakes and pastries, and anything which is an added sugar. You can go for natural sugars in the term of fruits, you can go for dry fruits. Anything which gives you natural fruits, you must include in your diet. I mean, and anything which is not natural, try to avoid that. More important, along with food and diabetes, is that see that you exercise and walk at least for 20 to 30 minutes twice a day, of course, after taking advice from your doctor. Okay, so we have one more nice question coming here, that I'm 5 months pregnant and I have been gaining too much weight recently. How can I control it with my diet? Now, one thing is that, like I said, plan your diet well, in the sense, see that it has got the essential ingredients. Secondly, is when you're with your diet, you need to see that no extra sugars. You have to cut down on bakery foods, on kinds of baked foods, kind of items, and along with that, you really need to see the whether you are binging on fried foods. It is very common to feel craving a craving for kind of fried foods and bhajiyas and samosas and all kind of Indian junk food also, we could call it. So you would need to see that whether you are actually going in for kind of these kind of foods, and you have to avoid those things. Especially, you need to also check if you're gaining too much weight, whether your sugars are rising, and more important, whether your blood pressure is rising, whether you have any thyroid issues. You need to go check with your doctor whether anything about this is into place, or whether you're having less of proteins also can make you put on weight. Okay, so this is something which I said in the beginning, that many, all women, or of course every mother wants, every parent wants that the child should be intelligent. So what food should I include in my diet to support my baby's brain development? Very important, that you must remember that baby's brain development occurs, 90% of baby's brain and synapses have occurred when the baby is born. After that, up to 5 years, you can actually contribute to the development of your baby's brain, and after 5 years, there's hardly 5% of the brain that is remaining to develop. So most of that is done when your baby is born. So for the food, if you ask me, apna dadi ma ka almonds are the best, because they give you good amount of fatty acids and good quality fatty acids. So fish, if you are non-vegetarian, fish is also a very good ingredient in your diet, because it gives you vitamin E and it gives you the oils. Fish oils are also important, but if you're a vegetarian, almonds is something, milk is something that is going to help you, and you have walnuts in your on your plate, along help the brain's development. It's not only about the food; it's also about how you think, about what you read, about what you have actually how you're going through your pregnancy. That is also going to decide how your baby's brain is going to develop. As far as baby's brain is development is concerned, of course, food definitely plays an important role. It has to be like it has to be food which is fresh. It has to be food which is consumed in a happy manner. It can't be that you're consuming food in a very hush rush all the time. Once in a while, yeah, I can understand if you're working, or you have a lot of responsibilities, it does happen. But all in all, what the food that you eat, finally what is absorbed, how it enters your circulation, and how it is going to affect your hormones, also depends upon the kind of food, and also the kind of mental makeup when you're having the food. So let's see that if you are happy, your baby is also going to be happy. Okay, so we have one question, is how can I plan my meals for healthy weight gain during pregnancy? Like I said, for healthy weight gain, first thing is that you have to see that the ingredients are correct. So I would say, your morning breakfast should essentially have, say, milk, fruits, boiled eggs, or dry fruits or something, and one simple small meal, very short snack, I could say, in the morning for your breakfast. Your lunch essentially should have good amount of sprouts. It should have dal. If you're a vegetarian, you can have chicken, or you can have non-vegetarian foods also, which give you good amount of protein. Plus, along with that, like I always tell my patients, that you should have at least, milk is a good ingredient. You should consume milk. But yeah, I mean, there are a lot of controversies about milk, but still, milk is an essential ingredient in pregnancy. Along with that, you should see that you have at least two kinds of fruits every day. Now, what kind of fruits that we are going to actually look at is, I generally say that, take one pulpy fruit and take one juicy fruit. If you have taken one pulpy fruit, you've ensured that you've got good amount of calcium, you've got protein, you've got good amount of iron, and calories as well. When you're taking the juicy fruit, what is happening? It's going to give you vitamins. And when you have vitamins, it's going to help your immunity, it's going to help your baby's immunity. So it's very important that when you're planning your meals, that you have fruits in your on your at least 2 or 3 portions of fruit, good amount of dal, because that gives you good quality proteins. And also when you're monitoring the weight throughout your pregnancy, like generally in the first 3 months, most women will put on around 1 kg. The next 3 months you should have averagely put on. So yeah, so at least 5 kg in the last 3 months. So now that has to come from healthy foods. I would be strongly against having junk foods. I mean, junk food in the sense, once in a while, say in a month's time, you are having a little change. I would be okay with that. But I would still prefer that you may have fresh homemade food, because that is something which is also going to reduce the chances that you will have any kind of infection in pregnancy, because we don't want any deterioration to occur. So that's why we want that we want that healthy, fresh, and hygienic food also is equally important. So if you're trying to make junk food at home, that is also okay once in a while. But yeah, I mean, so you have to make your choices. Like when I always say that you have a choice to make, what will you choose? If you have idli and you have bread burger, I will say go for idli, because it's going to give you good proteins, it's going to give you dal, it's going to give you rice, it's going to give you good amount of ingredients, rather than going only for a sandwich or only for a bread. But if you have that as well, then see that you're stuffing it with good amount of vegetables and fruits and everything. So that is important, that your junk food also, you have to plan what kind of junk food you are going. Junk food in the sense, I mean, try to avoid that. And more important is that you have to realize that now you're going to be parents. It's not only for the moms, it's also for the dads, that you're going to have a baby in the house, and the baby is very very observant. जो मम्मी पापा खाते हैं वो बच्चा always is going to be a freak out on that. So you have to be very careful as to what you are eating, how you are eating, what are your diet habits, how are your diet regulations in the house. Because generally after 2 years we'll have mothers coming saying मेरा बच्चा दूध नहीं पीता, ये नहीं करता. I say, okay, it's sometimes karma is playing back. So let's start when you're pregnant. Have change your family diet habits right from the time when the pregnancy is there, and that is probably something which is going to cause you to actually have a nice and healthy and happy baby. So I think we are coming to the close of this session. I think we have a few questions. So but I would want to end by saying that plan your diet well. Your diet is going to reflect in your baby's health. The store of iron, the store of calcium, the store of proteins, the store of good health is coming through your diet, and your baby is going to carry this whole diet, and it's whole I would say the whole architecture of the baby, or the whole structure of the baby is going to come through the pregnancy. And that what you give through those 9 months is so vital. That is going to decide how healthy your baby is going to live for the next 80 years. At least 80 years is the life expectancy. So that is those next few years, that is how your baby's health is going to be decided. So if you want that your baby lives healthy, happy till at least 80 साल तक 100 साल भी जिए, पर फिर भी एटलीस्ट a good happy 80 years of life, then it is the time is now in pregnancy. How you're eating, what you're eating, how you feel when you eat, and then communicate with your baby, because babies are very smart, they communicate. I have patients who come and say ki mango khaya, the baby is giving a good kick. So that's nice. And so if the baby also is telling you that mom, this is healthy, please khao, I'm giving you a kick, or I can feel the movement. So your baby also starts responding to good foods. So the habits of the baby begin in the womb. So thank you so much, Baby Chakra. And you can follow me on Baby Chakra by using my referral code. And my hospital details are on my referral code and on the web page. And I'm in Nasik, and but you can still follow me. I am quite active on these on small accounts here. So thank you very much, and hope to see you soon.